How health equity affects Indigenous people. Hi, my name is Juliana, and these are my group mates, Jo Luth, Lyra, and Emma, and we will be talking about health equity, or more like lack of health equity, among the healthcare system. Firstly, we define what health equity is and how it differs from health equality. Health equity is defined by the Cambridge Dictionary as the ability to recognize individual circumstances, thus allocating resources and opportunities based on them to reach an equal outcome, whereas equality is where everyone gets equal opportunity. In this illustration, we see in equality that all three figures are given one box each to overlook the fence, while in equity, the three figures were given boxes based on their needs. Therefore, the shortest one got 2 so they could oversee the fence. Now we will inform the lack of health equity through examples like the water advisory among many Indigenous communities and the mistrust of Indigenous people towards the healthcare system, which is seen through the Coil Project and an article about a Cree woman. We will also discuss in ways of avoiding these inequalities through programs such as the Jordan's Principle, and how this will affect us as nurses and how we will proceed in our jobs with the knowledge that we now know.
We begin this discussion with water advisories.
Can you imagine life without clean, fresh water? According to the World Health Organization, as of 2008, 100% of urban and 99% of rural dwellers in Canada had access to clean and sufficient water. The 1% of Canadians without access to potable water consists overwhelmingly of Indigenous people on remote reserves, and 12 to 13% of Canadian reserves are under boil water advisories at any given time. Lack of access to potable water has tangible and tragic consequences. International organizations have brought attention to the fact that the incidences of waterborne diseases is exceptionally high in First Nation communities in Canada, and the federal government admits that a lack of potable water leads to serious health problems. Infectious diseases lead to preventable deaths, and poor water quality contributes to infant mortality rates that are up to 4 times higher for unreserved Indigenous babies than for other Canadian babies. As nurses, we know that fresh water is equals to healthy living, which is equals to equity. So we need to keep advocating for more fresh water for Indigenous people.
Next, we will discuss mistrust, which has resulted from a lack of health equity through examples from the Coil Project and a Cree woman's personal story. A lack of equity in the healthcare system can be seen in the difference of treatment of Indigenous versus non-Indigenous people. Let's take a look at an example that was shown in the Coil Project. Bernadette was hesitant to go to the hospital because of her past experiences, like how her aunt was treated badly in the hospital and ended up passing away. Further on in the scenario, they discussed in a meeting the challenges that Bernadette faced in her community, such as expensive food prices, which hindered her health from improving. To meet her unique needs, a home care plan was created with an Indigenous liaison and her sisters in the room to ensure that there would be no issues once she was discharged and went home. Bernadette's specific needs were met by resources such as involving a dietitian and liaison, creating a specific and affordable food plan for her family, and options such as hunting. Here's a recent example from this year. In Edmonton, a Cree woman has filed a lawsuit against the hospital where allegedly her newly delivered daughter passed due to a lack of medical care from staff. Because of the neglect from health staff, they did not receive the adequate care and resources they should have gotten. Such neglect would not have happened if they were non-Indigenous. These are just a couple of the many experiences where there is evident neglect and racism, which has impacted Indigenous people's view of the healthcare system. In both examples, healthcare providers fall short of achieving health equity. Indigenous people are not being treated on the same level as non-Indigenous people, and the resources they need are not being provided. Moving forward as nurses, we can actively practice health equity by asking questions such as, do you have any values and beliefs that I should know about? In this way, each patient is treated specifically based on their needs, and Indigenous people's mistrust can turn into a relationship of trust. And we will now conclude with Jordan's principle.
For those who are unaware of Jordan River Anderson, he was a young boy from Norway House, Cree Nation, who was born in Winnipeg Children's Hospital with complex medical needs. When he was 2 years old, doctors decided he was able to go to a specialized foster home so that he was closer to his family. Unfortunately, the federal and provincial governments could not agree on who would be paying for his home services. While the governments conflicted, Jordan stayed in the hospital even though doctors said he didn't need to be there anymore. Because of this, he passed away at the age of 5 without the opportunity for him to experience living his life with his family. Jordan's story is an example of the lack of health equity that Indigenous people receive. He was treated unequally because of his Indigenous background and therefore spent his life in a hospital setting away from his family. The primary role of us future nurses regarding Indigenous health is to understand the impact we can make by prioritizing Indigenous patients and treating them based on their needs. We should recognize that health equality doesn't always work because it treats everyone the same, regardless of differences. Thus, focusing on health equity will enable each person to receive the resources they need to reach the same outcome. From Jordan's legacy, we can learn how systems and policies can be put in place to prioritize each child's life, and so that no other child will have to risk losing their life over government disputes.
Lastly, we discuss how it affects us as nurses. With the knowledge that we now know, we can be more culturally sensitive and aware of their past and how it will be affecting them in the present and also in the future. It opens our way of thinking and eliminates our implicit and explicit bias towards them, which promotes a sense of healing towards the Indigenous communities. We bring it back to the definition of health equity and how it allows us to properly provide our care and resources based on individual circumstances and needs. We have seen many examples of lack of health equity. By advocating for changes such as reserves receiving proper drinking water, understanding people's individual circumstances and values, and eliminating the barriers that the historical past has created, like racism and colonialism, we as nurses can properly meet the needs of Indigenous communities and its children. Through our actions, we are able to fill in the gap to provide a more equitable and holistic care for Indigenous people.